Okay, we are team number 2 and we are going to present our challenge of image quality assessment for a diagnostic imaging department. As introduction, we have every year Mexico City conducts hundreds of thousands of diagnostic imaging studies. This high volume highlights the crucial need for maintaining high standards in image quality to ensure accurate and reliable diagnostic. To achieve these high standards, it is essential that medical imaging facilities and equipment meet specific criteria. These ensure the quality of diagnostic images and safeguards the safety of both patients and the personnel involved. A key aspect of this project involves the creation of various types of phantoms: bone density, soft tissue, and contrast phantoms.
About the CRM X-ray system, we can tell it is a versatile medical imaging device commonly used in various diagnostic and surgical procedures. Named for its C-shaped arm that connects the X-ray source to the detector, the system can allow us a flexible positioning around the patient, providing a real-time fluoroscopic imaging. This capability is particularly valuable in procedures such as orthopedic surgeries, cardiac interventions, pain management, where precise continuous imaging is crucial for the treatment and outcomes.
The main objective is to construct a high-fidelity phantom that accurately simulates specific human body parts for use in medical imaging research, training, and quality assurance purposes. To optimize the C-arm X-ray system settings and protocols using the created phantoms.
The scope of work of our protocol turns into the implementation of the phantoms in the CRM X-ray system to evaluate their performance, as it also helps in the analysis of imaging results to validate the effectiveness and accuracy of the phantoms. For this project, we were able to work with the Sierra Philips Pulsera. In their options about type of exams, it includes orthopedics, chest, abdominal, and head column. Some clinical applications that it can be used for are orthopedic surgery, that helps in precise alignment and positioning of bones and implants, cardiovascular procedures that provide real-time imaging during the catheterization and stent placements, pain management that can assist us in accurate needle placement for pain relief treatments, and emergency medicine, which can quickly help with imaging in trauma cases. About the specifications of this model, it includes the rotating anode X-ray tube. It is also equipped with a flat panel detector, and well, about the radiation time with the patient, it can vary depending on the imaging protocol and the specific procedure that will be done to the patient.
We propose three phantoms. One is a lot of bone, a little bone, and needles. Phantom 1 and 2 are gonna help us to measure contrast and uniformity, and the needles are gonna help us to measure spatial resolution.
For a rapid context, by contrast, we mean to the difference in the visual intensity or density between the different areas of an image. It is essential for the distinguishing between various tissues, structures, abnormalities within the body. When talking about uniformity, we can tell about the consistency and evenness of an image intensity across the entire field of view. An image with high uniformity has a consistent signal or brightness, without a significant variation or artifacts, ensuring that all parts of the image are accurately represented. Finally, we have spatial resolution, which is the ability of an imaging system to distinguish small details and structures that are close together within an image. It can indicate us how finely an imaging system can visualize the boundaries between different structures.
The experiment with our phantoms aimed to comprehensively evaluate the CRM X-ray system's imaging performance in terms of uniformity, contrast, and spatial resolution. Each test targeted specific aspects critical for accurate diagnosis and cost-effective clinical use. For the first part, the spatial resolution of an image system is defined as the ability to distinguish fine details in an image. It is expressed as the minimum size of two objects that can be distinguished from each other. In the part of the soft tissue simulation, we use the resin because it was our reference of male skin, fat, or muscle textures. In the uniformity, well, in the context of the image uniformity, a high standard deviation indicates a greater variation in the brightness or color of pixels across the entire image. This means that the image does not have a constant brightness or color, but instead has lighter and darker areas or variation in color tones, when in general it means that the image is less uniform in the visual appearances. In the contrast, sometimes it is necessary to change the degree of contrast to obtain greater details and information from the X-ray. The kilovoltage is the factor that regulates the contrast. High kilovoltage provides a longer scale, and a low kilovoltage provides a shorter contrast scale. In Fujis measure tool, the mean value represents the average pixel intensity with the region of interest. Well, in the image scale, the average intensity is typically expressed in a range of 0 to 255, where 0 represents black and 255 represents white. A high value of mean indicates that the region is relatively bright, while a low value indicates that the region is dark. First, in order to interact with the images in PG, we use MATLAB to convert the images from BMP files to PNG. Well, with the help of the analysis, the visualization of the images of the phantom and the coordinator presents at the institute, we obtained that the best image is at 52 kilovolts with a better contrast, since it has an intermediate standard deviation, defining that it has more constant variation of brightness and color of the pixels than the other two analyses at 60 and 64 kilovolts respectively. On the other hand, when evaluating the average visually and numerically, we can highlight that with a higher average, the image will be brighter, which appears that the higher the kilovolts, the absorption of the bones is lower, since it does not adequately absorb radiation crossing the bone surface. Therefore, the phantom with little bone has a higher average, since there is less radiation absorption. As in the previous case, processing had to be done with the help of MATLAB, which was to invert the image to negative, since when plotting the full width half maximum, the G values are from 0 to 255, causing the peak to come out inverted. Well, in our full width half maximum is 69.3. It means that our phantom has a high full width half maximum value, which indicates that the system has a low spatial resolution, and that the fine details may be blurred or not clearly distinguishable.
Finally, to conclude this project, we can tell the custom phantoms developed for evaluating the X-ray system effectively provide precise metrics for uniformity, contrast, and spatial resolution. Designed to simulate human tissues accurately, these phantoms enable comprehensive assessment of imaging performance. The use of Fiji for measurements ensures an exhaustive evaluation, validating the phantoms as reliable tools for calibrating and testing the X-ray systems. Our findings underscore the importance of well-designed phantoms in optimizing imaging protocols, enhancing diagnostic accuracy, and improving patient outcomes.